Welcome to the anatomy and mobility assessment of the joint freeing sequence. The following series will provide you with details of the joint freeing series and describe the muscles contracting to create the motion in the normal range of suppleness. Here we have plantar flexion. Normal range of motion is 50 degrees. This creates a straight line from the top of the foot, even with the shin bone. Two muscles are involved in creating plantar flexion, a surface calf muscle called the gastrocnemius and a deeper muscle, the soleus. Both muscles attach to the Achilles tendon at the heel. The gastrocnemius begins above the knee on the posterior side of the thigh. Hence, its contraction will also flex the knee. The origin of the soleus is upon the posterior head of the outer shin bone and the middle third of the posterior tibia. Because of the leverage exerted at the ankle, these two muscles are tremendously strong for their size. Ordinary activities include walking, as you momentarily lift your heel to balance on the ball of your foot and toe. Ankle dorsiflexion. Normal range of motion is 20 degrees. One way to analyze this is to sit in Dandasana and place the sole of your foot against the wall. Then pull the ball of your foot away from the wall while keeping your heel against the wall. These muscles are assisted by the perioneus longus and the perioneus brevis. Normal flexibility would create a 1-inch space between the wall and the ball of your foot. Attention should be maintained to keeping the rest of your leg motionless, especially your knee. The tibialis anterior muscle originates from the upper lateral portion of the tibia and attaches at the base of the ankle, well above the great toe. When it contracts, it pulls the foot towards the shin and inverts the big toe. It is especially involved in running or walking uphill and is aggravated in the creation of shin splints. Ordinary activities of this motion are walking uphill and lowering your heel as you step down from a ladder. Ankle eversion. Normal range of motion is 20 degrees. In this motion, the outer foot is pulled towards the head about an inch. The movement is usually accompanied by adduction, giving the ankle more flexibility. The foot everters consist of the perioneus longus and the deeper perioneus brevis. These two muscles originate on the upper and middle lateral surface of the fibula and attach beneath the lateral side of the foot. They assist in ankle plantar flexion. Ordinary activities of this motion include kicking a ball sideways or the action of the upper ankle when walking across a sloped hill. Ankle inversion. Normal range of motion is 45 degrees. In this motion, the inner surface of the foot near the great toe is lifted about 1 inch towards the head. This motion is done with abduction, giving the ankle greater mobility. The ankle is the most commonly sprained joint in the body. The muscle involved in ankle inversion are on the opposite side of the lower leg. On the right side, the tibialis posterior. This is an accessory muscle to the previously seen tibialis anterior, located on the front of the shin. The tibialis posterior originates on the upper half of the adjacent surfaces of the posterior tibia and fibula. It inserts at the bottom of the foot, forming the long arch of the foot. A common motion in soccer would be a sideways kick with the inner foot. Ankle rotation. This movement combines the muscle and ranges of all the previous motions. Provided those motions are normal, the circling of the ankles will allow your feet to reach the floor on both sides with a smooth motion. Go slowly to incorporate all the muscle groups involved, including your toes. Knee flexion. Normal range of motion is 150 degrees. At this range, the heel will come within the width of your hand to touching the back of your buttocks. The major muscle involved in knee flexion are the hamstrings, which are composed of 3 separate muscles. They share a common origin at the base of the sits bones, your ischial tuberosity. The gastrocnemius also flexes the knee. In addition, the gracilis and sartorius assist in this motion. Looking from right to left at their insertions on the back of the lower leg, the hamstrings are the biceps femoris, with 2 origins on the ischial tuberosities and the central portion of the posterior femur, It is the only hamstring attaching to the lateral surface of the lower leg at both the fibula and the tibia. The semitendinous, inserted at the front inner surface of the tibia, and the semimembranous, ending just above the previous section on the posterior medial section of the tibia. It is medial from the semitendinous. Common motions, including bending of the back knee during walking or lowering yourself to sit in a chair. Sitting on your heels require full flexion and is normal mobility. Knee extension. Normal range of motion is 0 or 180 degrees, a straight line. In the stick pose or dandasana, the ability to lift the heel more than 1 inch while the back of the knee stays stationary on the ground indicates a hyperextended knee, one that is too flexible. The muscles that straighten the knee are the quadriceps, meaning 4 heads. That is, they are 4 muscles that all insert into the patellar tendon, in which the kneecap rests. They are assisted by the tensor fasciolata. The rectus femoris is the king of the thigh. It's the major muscle originating above the hip joint on the lower border of the pelvic rim, or the ilium. It also serves with the psoas as a hip flexor. The vastus intermedius lies beneath the rectus femoris, beginning on the upper 2/3 of the anterior femur. The vastus medialis occupies the inner and lower portion of the thigh. The vastus lateralis lies on the lateral femur. A common use of this motion is getting up from sitting in a chair or the act of straightening your knee during walking. Hip external rotation. Normal range of motion is 45 to 60 degrees. In full mobility, the kneecap can rotate halfway to the lateral side. This motion is the outward rotation of the thigh bone with the hip socket. The hip external rotators are a group of 6 deep muscles located beneath the gluteus maximus, which is also external rotator. They all insert on the posterior of the femur and originate at various points on the posterior internal pelvis. Viewed from top to bottom, the muscles are the piriformis. Below it lies the sciatic nerve, the gemellus superior, the obturator internus, the gemellus inferior, the quadratus femoris. Obturator externus. The gluteus maximus is a potentially powerful external rotator. Simply taking a greater stride as you walk can increase its strength. Its fibers originate on the posterior iliac crest, sacrum, and coccyx, and insert on the upper posterior femur, as well as the iliotibial band of the tensor fasciolata muscle. The posterior portion of the gluteus medius assists in this motion. Common activities of this motion are ballet turnout and crossing your ankle over the opposite knee while in a seated position. Hip internal rotators. Normal range of motion is 35 degrees. With full motion, the kneecap can turn nearly halfway inward while the hip remains stationary. The 3 muscles involved in internal rotation are the gluteus minimus, the tensor fasciolata, and the anterior portion of the gluteus medius. The gluteus minimus, below the gluteus medius, originates on the middle lateral surface of the ilium and inserts at the anterior surface of the head of the thigh bone. The tensor fasciolata muscle is short, usually about 6 inches long, and begins just forward above the gluteus minimus. However, because it inserts into the longest tendon in the body, the iliotibial band, its full length is greater than that of the thigh bone. This tendon in turn inserts at the lateral head of the tibia. Common activities include the motions of the outer hip in turning a corner. Spine extension. There are no standards set in physical medicine for this motion. From a yogic point of view, we look for symmetry and fullness in back bending and for a lengthening of the spinal column. In this sense, all segments of the thoracic region can be reversed and the lumbar region can elongate, thus narrowing your waist. The principal muscles involved in extending the spine are collectively called the erector spinae. They are composed of 6 primary segments: the semispinalis capitis, the splenus capitis, the splenus cervicus, the iliocostals, the longissimus, and the spinalis. These muscles are assisted by the latissimus dorsi when the arms are actively assisting, while being held posterior to the shoulders, as in the cobra pose, using the arms. Common motions include sitting up straight, arching your back to look at the ceiling, or raising your chest and upper back from a prone position. Spinal flexion. There are no standards of range of motion for spine or trunk flexion. A yogic point of view is that if the tone of the spine flexors is balanced to the opposing muscles, the erector spinae, the spine arcs evenly, creating a symmetrical semicircle. The major muscles involved is the rectus abdominis, the king of the abdomen. It originates on the cartilage sections of the 5th, 6th, and 7th rib. Shaped like a V, its attachment is located on the crest of the pubic bone. The paired muscles are connected by a central line of fascia called the linea alba. This muscle is divided into 4 segments by connective tissue. Each of the segments can act independently. Thus, abdominal tone can vary from upper to lower regions. When good tone is maintained, it supports the position of the digestive organs and maintains healthy spinal posture, thus minimizing pressure on the spinal discs. Among the common activities are sitting up, forcibly rounding your spine to stretch it, and curling into spoon pose for snuggling your teddy bear or sleeping on your side. Hip extension. Normal range of motion is 30 degrees. In this motion, the knee rises above the level of the buttocks. Analysis of this motion is deceptive since lumbar flexion accompanies hip extension and accounts for half the motion, about 15 degrees. The major muscle performing hip extension are the hamstrings, previously shown when we did the knee flexion, and the gluteus maximus. The gluteus maximus is a potentially powerful hip muscle that also externally rotates the hip. It attaches along the outer portion of the femur and connects through fascia to the iliotibial band of the tensor fasciolata, which also assists in knee extension. Common motions are the crawl, stroke, and swimming, and the action of the backward leg during walking and running. Hip flexion. Normal range of motion is 135 degrees. With this freedom, the thigh can come within 2 inches of touching the lower rib. The major muscles are the psoas, technically the combination of the iliacus, which lines the inside of the iliac pelvic bone, and psoas attaching to the spine are functionally called the iliopsoas, and the rectus femoris, and 7 other muscles, 5 adductor, sartorius, and the tensor fasciolata. The psoas runs from the front of the body to the back, from the front groin to the anterior lateral sections of the lumbar spine. The psoas originates from the lateral bodies of the last thoracic and the first 4 lumbar vertebrae. The iliacus terminates on the internal crest of the pelvis and the lateral border of the sacrum. It also assists in external hip rotation. Just lateral to the psoas is the quadratus lumborum, connecting the iliac crest to the lower ribs. It serves to elevate the pelvis and laterally flex the spine. Common motions include squatting, sitting, and lifting your thigh to walk upstairs. Hip adduction and hip abduction. Let's first talk about hip adduction. Normal range of motion is 30 to 40 degrees. In full motion, adduction contracts the groin muscle. The hip adductors located in the groin have the most mass of the thigh muscle groups. They all originate from the lower border of the pelvis at the ischium and pubic bones, making them hip flexors. With the exception of the gracilis, which terminates on the tibia, they insert along the femur. The muscle making up this group are your pectinus, the adductor longus, the adductor brevis, the adductor magnus, the gracilis. Among the most common motions are crossing your thighs when seated, squeezing your thighs while rising horseback, and standing in a long line waiting for the restroom. The yoga asana of Gomukhasana is full range of motion for hip adduction and external rotation. Let's talk about abduction. Normal range of motion is 45 degrees. The major abductor muscle is the gluteus medius, located anterior and below the gluteus maximus and shaped like an open fan. The gluteus medius originates along the upper outer surface of the ilium and attaches on the upper lateral surface of the head of the femur. This muscle's anterior fibers also perform internal hip rotation, while the posterior fibers do external rotation. Assistance in this motion comes from the psoas, the sartorius, the gluteus minimus, the gluteus medius, and the tensor fasciolata. Common motions include swinging a leg out of the car or spreading your thigh to make a wide sideways step. Wrist flexion. Normal range of motion is 90 degrees. The wrist flexors move the hands through an arc. Taking the palm of your hand towards the elbow, full motion will make a right angle between the forearm and the hand. The major muscle contracting to create this muscle attach on the hand. Viewed from their insertion left to right, thumb and little finger, they are the flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. These are located on the palmar surface of the forearm, originated from the inner bone of the upper arm, or your humerus. Common motions are combing your hair and curling weights to your chest with your palm upward. Wrist extension. Normal range of motion is 80 degrees. This is stressed by the hyperextension required in certain yoga poses such as Dandasana, Purusvattanasana, and Ustrasana. The usual placement in these poses can aggravate carpal tunnel conditions. To avoid overstretching this condition, I recommend that you reverse your fingers to point them away from your body during these asana. The major muscles involved are the extensor carpi ulnaris, the extensor carpi radialis brevis, the extensor carpi radialis longus. All originate on the lateral elbow and the humerus. The ulnaris ends at the wrist base of the little fingers. The brevis ends at the wrist base of the middle finger. The longus ends at the base of the second metacarpal bone. This motion is used to indicate stop. These muscles are constantly contracted during keyboarding activities. Radial deviation and ulnar deviation. Let's begin with radial deviation. Normal range of motion is 20 degrees. The movement is an arc from a neutral position. The thumbs move towards the radial bone. The muscles strengthened by the movement are the flexor and the extensor carpi radialis. Both were cited previously in wrist flexion and wrist extension. A common motion is cleaning the outermost sections of a tabletop or window. Ulnar deviation. Normal range of motion is 30 degrees. The little finger moves towards the ulnar bone. The muscles strengthened are the flexor and extensor carpi ulnaris, shown previously under wrist extension. A common motion is turning a dial clockwise with the right hand. Wrist rotation. Wrist rotation is a combination of the four preceding motions utilizing all the muscles previously cited. To create a fluid motion, the full range of carpal joints must be free. Elbow extension. Normal range of motion is 0 degrees, a straight line, with the upper arm level to the forearm. It is fairly common to see women who have a hyperextended elbow, in which the elbow goes above the adjacent segments, often accompanied by pain or discomfort. The major muscle contracting to form elbow extension is the triceps brachii. Triceps means 3 heads, referring to 3 origins of the muscle. The superior head of the tricep is the lower lateral border of the scapula. The other heads are on the upper sections of the humerus. The insertion point is the point of the elbow. The triceps brachii also performs shoulder extension. Among the common movements are putting down a weight carried in your arms, the end of a golf or baseball swing, and throwing a ball. Elbow flexion. Normal range of motion is 145 degrees, a point at which the biceps will make contact with the forearm. It is common for women to have a carrying angle in which the forearm deviates from making a straight line with the upper arm. Usually there is no discomfort associated with this, though it may give a leverage disadvantage in attempts to strengthen the elbow flexors, the biceps and shoulder flexors, and the deltoids. The biceps brachii of the upper arm has 2 heads or origins. both located on the front surface of the scapula. The terminus of the muscle is on the upper medial section of the radius. Due to this attachment point, the muscles also contract to supinate the forearm, turning the palm up. Another muscle in elbow flexion is the brachioradialis, extending the length of the forearm. Due to its leverage advantage over the bicep, it is comparatively stronger. Common activities involving this motion are picking up a bag of groceries or a child, hugging a friend, and embracing. Shoulder abduction. Normal range of motion is 40 degrees in a posterior direction. In full motion, the upper arm will move backwards, completely out of sight when facing directly forward. The muscle contracting is the posterior deltoid. It originates from the front outer third of the collarbone and connects to the back along the spine of the shoulder blade. Its fibers are involved in all lifting and rotating of the arm. This is a commonly weak muscle, often associated with chronic neck tension. To test it, hold your arms straight out for 1 minute without lifting your shoulder. This is often the first motion of the day, the morning yawn and stretch. When you have your arms overhead to get something from a high shelf, you are contracting your deltoids. Shoulder adduction. Normal range of motion is 130 degrees, allowing the elbows to touch and also cross each other in front of the chest. This is the motion required to complete Garudasana, or eagle pose. In this pose, the arms are crossed above the elbow and then intertwined in front of the chest. The muscles contracting to form the motion are the pectoralis major and the anterior deltoid, assisted by the biceps brachii and the coracobrachialis. The pectoralis major covers the entire chest, originating from the central third of the collarbone, the breastbone, and the cartilage of the first 6 rib. It lies beneath the breast tissue and helps to support their shape. It also contracts during shoulder internal rotation and shoulder depression. The anterior deltoid creates a rounded contour of the front of the shoulder. Common activities using this motion are when you reach across the chest to your opposite side. It is unfortunately used as a means to protect our emotional and physical hearts. Shoulder external rotation. Normal range of motion is 90 degrees. If this motion is done against the wall, the entire shoulder, arm, and hand lie flat to the wall. The prime movers are, from top to bottom, the posterior deltoid, the infraspinatus, and the teres minor. The posterior deltoid lies in an oblique line from the spine of the scapula to the lateral arm. The infraspinatus covers the basin of the shoulder blade. It starts on the inner 2/3 of the basin and inserts on the lateral head of the arm. The teres minor begins on the armpit border of the shoulder blade and attaches just below the infraspinatus to the posterior humerus. This is the wind-up motion of throwing a ball, or the action of your arms as they reach back to remove a coat. Shoulder internal rotation. Normal range of motion is 80 degrees. When performed sitting with the back and head against the wall, the shoulders and elbows would remain on the wall, but the wrists does not touch. The primary muscles contracting to form the motion are the clavicular portion of the pectoralis major, latissimus dorsi, the anterior deltoid, and the teres major. The pectoralis major and anterior deltoid were covered in shoulder adduction. The latissimus dorsi and the teres major were covered with shoulder extension. Movements include putting on your coat, putting your hands on your heart, or attaching your bra behind your back. Shoulder flexion. Normal range of motion is 180 degrees. Full range is achieved when the arm is in a straight line with the torso and directly adjacent to the ear. The prime movers to this position are the anterior deltoid, biceps brachii, coracobrachialis, and the upper or clavicular sections of the pectoralis major. With the exception of the coracobrachialis, located below and medial to the biceps brachii, these muscles were shown previously in shoulder adduction and elbow flexion. This movement is used to reach overhead and is often seen on winter Sundays, signaling a touchdown. Shoulder extension. Normal range of motion is 50 degrees. In this vertical motion, the arm is brought back and upward, halfway towards the horizontal. The primary movers are the latissimus dorsi, triceps brachii, and the teres major. The latissimus also internally rotates the shoulder. These muscles are assisted by the posterior deltoids and infraspinatus. The latissimus dorsi covers 2/3 of the middle and lower back. It originates from the central points of the lower 6th thoracic, lumbar and sacral vertebrae, and the medial half of the pelvic crest. It ends in a groove located just below the medial head of the upper arm. The teres major originates from the lower section of the shoulder blade and terminates just behind the latissimus on the upper arm. This motion is the backswing windup of bowling, the backstroke of sawing, or pulling ski poles behind you for more speed. Scapula adduction. Normal range of motion is not established. A full movement squeezes both shoulder blades close enough that the spine is not visible between them. The major mover for this motion is the middle trapezius between T1 and T5. The upper trapezius between C1 and C7 pulls the scapula in and upward, while the lower trapezius between T6 and T12 pulls the scapula in and downward. The trapezius originates from the points of the 7th cervical and all the thoracic vertebrae, and from the occipital ridge at the base of the skull. It inserts on the full-length upper border of the scapula's spine to the acromion. An assist in this motion comes from the rhomboids, located below the middle trapezius. This muscle elevates the scapula as it adducts them. The motion is used in bringing the body down during a push-up and in pulling the shoulders together to stretch the chest. A good idea following a long drive. Scapula abduction. Normal range of motion is not established. The movement in this case is accentuated by adding spinal flexion. The primary movers of scapular abduction is the serratus anterior. This muscle literally wraps around the rib cage with its insertion on the underside medial border of the scapula. Its origins are the upper borders of the first 8 or 9 ribs. Due to individual differences, some people have a larger muscle that extends further. When the shoulders are fixed, it can become an accessory muscle aiding deep in respiration. This motion is utilized in the lifting phase of a push-up or cat lift pose, and the embrace of a big teddy bear. To develop its full strength, you must exaggerate the rounding or the flexing of the thoracic spine, and in doing so, this often releases chronic shoulder, upper back, and neck pain. Spine lateral flexion. Normal range of motion is not established, though it appears to be about 45 degrees. With this mobility, the breastbone comes nearly halfway to the floor while the shoulders stay vertically aligned and the pelvic stationary. There are 4 principal muscles involved to create flexion to the right. All the muscles on the right side contract. The external abdominis obliques, which originate from the lower edge of the 8 lower ribs and inserts into the front half of the pelvis or the iliac crest, the pubic bone in the abdominal central tendon. The internal abdominis oblique, which begins in the lower border of the cartilage of the lower 3 ribs and inserts just beneath the external oblique on the iliac, the central tendon, and the lumbar fascia. The quadratus lumborum begins on the posterior iliac crest and inserts into the middle half of the lower ribs into the transverse process of the first 4 lumbar vertebrae. The erector spinae, the latissimus dorsi, that will assist when the shoulders are actively extended. We use this motion to pick up something from the floor beside our chair or during the wave at ball games. Spinal rotation. Normal range of motion is not established. It is greater, however, in the upper segments of the spinal column than in the lumbar. From a yogic perspective, the shoulder girdle will rotate 45 degrees so that the center of the chest will face halfway to the hip joint. The muscle contracting to the right are the right latissimus dorsi, left external abdominis obliques, and the right internal abdominis oblique. This motion is used when reaching behind your car seat to get something in the back seat, loosening or cracking your back, and in twisting dance motions. Neck extension. Normal range of motion is 55 degrees, enabling the forehead to come nearly parallel with the floor without moving the mid-back. At full extension, you can look at a point directly above you. The primary muscles contracting in cervical extension is the upper trapezius. It also elevates the scapula. Accessory muscles in the movement are located deep to the trapezius. What a rare motion it is to look up at the stars and wonder. Neck flexion. Normal range of motion is 45 degrees, which enables your field of vision to see your entire upper chest. The primary muscle contracting is the sternocleidomastoid, so named for three bones to which it attaches. The muscle originates from the upper breastbone, your sternum, and the upper middle collarbone, your clavicle, to insert behind the ear on the skull, your mastoid. A most common motion is looking down at what's beneath us. Yet, with humility, looking down brings us to the sanctum sanctorum, that is our own heart. Neck lateral flexion. Normal range of motion is 45 degrees, or halfway to the shoulder. When the muscles and joints are free, this is done without rotating the face downward. The muscle contracting to tilt the head to the right are the right upper trapezius, the right sternocleidomastoid. While uncommon here in the West, except out of discomfort from tension in one side of the neck, in India this motion done quickly means Asha, Hindu for I understand, or I agree. Neck lateral rotation. Normal range of motion is 70 degrees, which will enable you to look over your shoulder and see your upper shoulder blade. When the cervical motion is free, the head will remain level as it rotates. To rotate the head to the right, the primary contracting muscles are the left sternocleidomastoid and the right upper trapezius. Both muscles were detailed previously in neck flexion and neck extension. The motion, often strained, of looking over your shoulder while your back is fixed in a car seatbelt or shaking your head to indicate no. After working so hard on your mobility assessment, please take the time to go into your savasana, completely relaxing the body into the ground and letting space go into the joints of the body and elongating the muscles. Concentrate on your breath as we inhale and exhale, and just feel that beautiful connection between mind and body.